Hi, Chuck White with PHCC. I want to talk to you today about the phased approach the President has proposed for getting the economy back open and get some ideas about what his thoughts are and how he's planning on this working out. He has proposed, along with the medical professionals, proposed a three-phase approach which has to meet some initial gating criteria. So initially, some ground rules are going to have to be met, particularly symptoms of influenza type virus illnesses and COVID viruses. Those symptoms must be down on a downward trajectory. Cases of COVID, cases of influenza must be on a downward trajectory. And the percentage of positive tests of COVID-19 must be on a downward trajectory as well. All of that is over a 14-day period. So these are 2-week windows that things have to be looked at. Hospitals must not be treating all patients with crisis care. The hospitals have to stabilize out. There are some other requirements for being able to provide PPE and other necessary type things. All that must be met. Again, this is subject to state review, so various localities or states could make changes to this based on how much impact they are feeling from the virus. There are other conditions as well that pertain to individuals and to employers. Typical things we've been working with to date: hygiene requirements, washing hands, hand sanitizer, use of PPE, limiting group sizes and access for folks coming to work. Provided the gating criteria are met in a 2-week period, we would move into phase one. Phase one would, again, keep vulnerable individuals in the shelter-in-place mode. In public, when folks are out in public, they would need to have maximum physical distancing requirements. I'm going to call it PD here for short. We are moving away from calling it social distancing. We're not really intending that people are socially far apart. We just need them physically far apart. The groups need to stay less than 10 people or less. We're going to minimize non-essential travel in phase one, maintain teleworking as much as possible, and we're going to let people start returning to work in phases for less critical conditions, places where you don't have to work with lots of people. We're going to have folks keep common areas closed in workplaces. Consider offering special accommodations to vulnerable populations that are coming back to work. We're going to have the schools and bars and such still be closed. Large venues will be allowed to reopen, things like movie theaters, sporting events, that type of thing. But they're going to have to observe a very strict regimen of physical distancing. When you start getting larger groups together, we need to make sure folks are staying apart. That will get through phase one. The phase two section, we move through another second-day gating period. So if we're in phase one, we need another 14-day period where all of these conditions in the gating criteria can be met again. If they're not, if these gating conditions go the other direction, then we would move back. You would either restart a phase or move back to a previous phase. All of this is kind of a continuing process, and things have to be maintained. So in phase two, we're going to maintain the vulnerable folks still sheltering in place. We're going to still have physical distancing in public. We're going to open up and be avoiding groups greater than 50 people, but still maintaining physical distancing. Travel can resume. We will lift the non-essential travel ban. As far as the workforce is concerned, we're going to still maintain telework if possible, but folks can start coming back to work similar to phase one. Again, keeping common areas closed and offering special accommodations for those that are vulnerable population. Schools are going to get opened back up. Bars will open up with limited standing room capacities. It's a little unclear exactly what that means, but it will get the restaurants and bars open again. There are some other conditions that go with these phases. Again, very similar to some of the things we're doing now. I'm just trying to give you kind of a fast highlight of what's happening. So if we get into phase 2 and we again meet another 14-day gating period, so we have a third period where we make sure this all stays working. We would now in phase 3 allow vulnerable individuals to resume public interactions, again maintaining physical distancing. Low risk populations would be able to resume normal operations, normal groups, try to minimize the amount of time in crowds, large crowds. Work would return in really an unrestricted fashion. I'm going to let visits to senior centers and health cares resume in these other previous periods, phases. Those were prohibited. Large venues would be opened back up with limited physical distancing. You'll have to have some levels of physical distancing, but that's going to be much more liberal. The bars, restaurants will be open, and the limits will be much less. There will be some physical distancing, but standing room will be allowed, and get people back to work, get things opened up. We will have information posted on our COVID resource page, links to the actual document if you're interested. Please consult with your experts and make sure you're keeping safe and providing the proper care for your folks. And I hope you all stay safe during this time of crisis. Thank you.